Rideau Community Health Services Diabetes Education Program. Today we're going to be talking about testing our blood sugar. Did you have any questions or things you wanted to talk about today?
Oh, well, I just want to know how to test my blood sugar and why should I even do it?
Absolutely. So why we test our blood sugar is to check and see how our blood glucose is doing in between our 3-month average that we take at the lab. Okay? So when we get a reading on a glucometer, that's the little piece you can test at home, we're going to get some numbers there, and those numbers can be used to help assess how we're doing with our lifestyle and medications if we're on medications for blood sugar control. Okay? So do you know what numbers you want to see when you're testing your blood sugar?
Oh, I don't really know. I'm really just new to this.
Okay. So when we test our blood sugar, we have 2 different times. We have something that's called a fasting blood sugar. Okay, so that's first thing in the morning or before meals if it's been more than 4 hours since we've eaten. So that could be before breakfast, lunch, or supper. The targets for those numbers are between 4 and 7. Okay? Whereas 2 hours after meals, it's between 5 and 10. That's because we're going to get a little bit of energy from our meal and our blood sugar is going to go up a little bit. Okay, so that gives us a little bit of room for that blood sugar to go up between 5 and 10. Okay? So the other piece of this is how often we want to test our blood sugars. So for most people, we want to test our blood sugars about once to twice a week.
Okay, so I don't have to test every single meal every single day?
No, absolutely not. That would be too much.
I think my fingers would be sore after all that testing.
They probably would be. So usually what we want to do, this is generally for most people, we have a before and a 2 hours after meals once a week. Okay? So that could be week 1 could be before and 2 hours after breakfast. Week 2 might look like before and 2 hours after lunch. And week 3 might be before and 2 hours after supper. Okay? Another option for some people is maybe they'll do before breakfast and then later in the week they'll do 2 hours after supper or 2 hours after another meal. That way we can see some fasting readings and some 2 hours after meal readings to see if we're staying within that 4 to 7 and 5 to 10 targets.
Okay, so after I've done that for a while, I'm going to have all kinds of examples of different breakfasts, different lunches, different suppers where I've done some testing and can really understand the patterns better.
Exactly. And for some people, they might notice, oh, my after supper this day was above 10. Maybe make a little note to yourself to say, oh, that was a meal that was a little bit different. Maybe I had extra pizza or something like that. Then you can start to use those numbers to help assess what's going on. Okay? If you're seeing lots of numbers above those targets, then it's time to talk to your doctor or diabetes team about what the next steps are. Okay? So that kind of answers the how, the when, and the why we want to test. And I think the last piece probably is the how. Okay? There are lots of different blood glucose meters on the market. They're made by different companies. There's not really one that's better than the other. It's really just whatever's going to fit with you or sometimes what your pharmacy has in stock. Okay? So they all work the same way. Today we're just going to be talking about blood glucose monitoring, so that's when you prick your finger. Okay?
Is this going to hurt?
Not really. It pricks for a quick second and then that's it. Okay? When we test blood sugar, we only need a tiny little drop. You don't need very much blood at all. Okay? So inside your box from the pharmacy, you're going to get a blood glucose monitor, a lancet, and test strips. So those are the 3 things we're going to need to test blood sugar. Okay? If you have a diagnosis of diabetes and you're over the age of 65 or you have private drug coverage, you will get 200 test strips a year. Okay? And so if we are testing once or twice a week, you'll have plenty. Okay? So the other piece that we're going to need is part of our lancet and the little prick piece that's going to poke your finger. Okay? Each monitor has its own type of lancet. So today I'm going to show you how to use this one. Generally, they're all about the same.
Okay, perfect.
So this piece is going to come apart and the little colored piece is going to go inside. It only fits one way. You're going to twist off the little safety piece at the top and you're going to click the 2 pieces back together. Okay? This particular model you're going to pull back and then it's going to be ready to use.
Right.
Okay? We want to make sure that our hands are clean when we go to test our blood sugar. If there's any sugar, sweetness, or we've been preparing a meal, we want to make sure that our hands are clean because that could affect our blood glucose reading.
Okay, perfect. Well, I wash my hands, and I'm ready to test.
Perfect. So you can pick any finger, and we really try to encourage people to test one finger one day and another finger another day so you don't get any little sore spots. Otherwise, you're going to try and avoid the center of your finger and the area around your nail bed. Okay? So we're going to pull this back. The little test strip, when you take it out of the container, there's a little shiny piece on the end. We're going to try not to touch that. That's the piece that's going to go inside our machine.
Oh, and it looks like there's a drop of blood flashing, so it must be ready.
That's right, exactly. So now when we're going to pick a finger,
All right.
we're going to just gently press, put a little bit of pressure, push down on the button. There we go.
Oh, that wasn't so bad.
Just give it a little squeeze. Get enough blood. Sometimes you have to give another little squeeze. There we go. Perfect. So the reading came back at 7.0. Okay, so that's within that 5 to 10 range after meals.
It was about 2 hours ago that I ate my lunch, so I guess that's a healthy reading.
It is, that's perfect.
Good.
Just like today, sometimes practice makes perfect. You don't always get just the right amount on the right drop. So just take some time, be patient with it. Sometimes you have to give a tiny squeeze. If you have to squeeze really hard, it's time to try a new prick, okay? If you squeeze too hard, it can again affect that blood sugar glucose reading.
Right.
Okay? Any questions?
I don't think so. I think that pretty well covers it. I definitely understand better why I should test my blood sugar to learn more about how my blood sugar responds to different meals and maybe to different exercises that I do. And now I know I don't have to test every single day. If I'm just starting out, I can just test once or twice a week. So that's great.
Perfect. So make sure if you do have questions or concerns, you're finding a lot of readings above target on your machine, it's time to talk to the doctor or diabetes education team about what the next steps are. Okay?
Thank you so much.
You're welcome.